Good afternoon, everyone. We are 1 minute out. And Maine public, thank you for helping us show that video. Let us know if you're all square there. Good afternoon, everyone. I'm Nirav Shah, the director of the Maine CDC. I'm joined this afternoon by Commissioner Jean Wambrew from Maine's Department of Health and Human Services. Commissioner Wambrew and I are pleased to be with you today on World AIDS Day to talk with you about where we stand with reference to COVID-19 for the entire state of Maine for today, December 1st, 2021. I'll begin with an update on where we stand epidemiologically, and then a discussion about the Omicron variant, and then I'll turn it over to Commissioner Wambrew for some updates and news on a recent contest that we've had to get the word out about vaccination. I begin this afternoon, however, on another somber note. The Maine CDC is reporting 3 additional COVID-related deaths today. 1 was a resident of Penobscot County, and 2 were residents of York County. All 3 were men. 1 was in his 40s, while 2 were in their 60s. We'd like to take a moment to offer our deepest condolences to all of the friends, family members, and entire communities of these 3 individuals, as well as all of the others who have passed with COVID-19. Their 3 deaths bring our total number of deaths in Maine associated with COVID-19 to now 1,327. Statewide, there are a total of 120,600 cases of COVID-19 across the entire state, an increase of 938 cases since yesterday. Cumulatively, we've had 3,138 people who have been hospitalized since the beginning of the pandemic. And right now in Maine, there are 334 people who are in the hospital with COVID-19. A sad new record. 2 weeks ago, that number stood at 280 people who are in the hospital. Right now, there are 99 people in a critical care unit with COVID-19 across the entire state. 2 weeks ago, that number stood at 77. And right now, there are 49 people who are on a ventilator. That too is a sad and unfortunate new high point. 2 weeks ago, there were 36 people who are on a ventilator. Right now in Maine, we are aware of 6 children who are currently in the hospital with COVID-19, 2 of whom are in a pediatric intensive care unit. Across the entire state right now, there are 45 available and fully staffed intensive care unit beds. Turning now to testing. Our 7-day average PCR positivity rate has now risen to 11.6%, another high mark in the pandemic. And our testing volume stands at 456 PCR tests for every 100,000 people over the past 7 days. Turning to vaccines and vaccinations. Statewide, 72% of the entire state is fully vaccinated. And of those who are eligible, that is to say those who are 18 and over, 29.8%, 30% of the eligible total population of the state has gotten a booster dose. We take a look at the group that has been most recently made eligible for vaccines, those children aged 5 to 11. Maine is off to a strong start. 28.4% of children between the ages of 5 through 11 have gotten at least their first dose of vaccine right now. Overall, Maine is administering about 5,620 doses of vaccine every single day. Now that's first doses, second doses, boosters, vaccines for kids, all of it. But over the past week, 73% of all the doses that were administered across the state were for boosters, and about 15% were for first doses. That's important because boosters are essential right now. If you've been vaccinated and you are eligible for a booster, you should go get one. And finally, before I turn things over to Commissioner Lambrou, I wanted to take a moment this afternoon to discuss the Omicron variant of COVID-19. You've undoubtedly heard about Omicron, probably first during your Thanksgiving holiday. What I want to do today is talk about what we know, what we don't yet know, and what all of this means for you right now. The emergence of this new COVID-19 variant, Omicron, drew some degree of concern from scientists around the world because of the large constellation of mutations that this particular virus exhibits. Late last week, on Friday, the World Health Organization labeled Omicron a, quote, variant of concern, which to me is about right. It is a concern. The question now is not whether it's a concern, but whether it's a threat. And if so, to what degree? The bottom line there is that more scientific data are needed before we jump to any conclusions there. Now, Omicron has now been detected in the US, in at least California. And as with prior variants, it's a matter of time before Omicron arrives here in Maine. What I want to talk about today is where we stand, what the key questions are, and what things you can start doing today to prepare. Right now, there are a few areas of inquiry, scientifically, that researchers around the globe are looking into to help us better understand what degree of concern Omicron presents. One of those is how contagious is the virus itself. The pattern of mutations in this new variant led to concerns that it might spread from person to person more easily. This concern is buttressed by an increase in cases in a province in South Africa where the variant was found. But again, we need more data to really nail down whether that increase in cases was because of the Omicron variant or perhaps something else, say a super spreader event or a series of super spreader events that could have also led to that same uptick in cases. Now, this is what epidemiologists do. We try to disentangle correlation with causation to really better understand just how contagious this new variant is. The second area of inquiry is the degree of vaccine protection that we can expect to see in light of Omicron. This is arguably everybody's top concern. Whether Omicron will be able to sidestep some of the immunity provided by vaccines is no doubt on everyone's mind right now. And unfortunately, there have been conflicting statements on this front just in the last 24 hours. The reason for some of those conflicting statements is that the answer to this question about the vaccine's effectiveness is not a binary one. It's not going to be a black and white yes or no, but rather a sliding scale of protection. It will take some time for scientists to understand just how well the current vaccines hold up in the face of Omicron. But here's the key. If you're vaccinated, your immune system is not a blank slate anymore. Just as the virus can adapt, so can your immune system. Even if your immune system is facing a slightly different variant, Omicron, from the ones that were in the vaccine, your body's immune system has an amazing degree of plasticity, and it can adapt even to something that it really hasn't seen before, but that it's seen something resembling. That's the scientific question that's underway right now. And some virologists and immunologists with whom I've had the opportunity to speak just in the past couple of days have suggested that our body's immune system is so remarkably resilient that they believe that there will be some degree of protection from the current vaccines, Just how high degree of protection that is, that's the question on the table. A third question is around the severity of the disease. Does Omicron land a greater or higher percentage of those whom it infects in the hospital, in an ICU bed, or on a ventilator? It's too early to tell. Though, thankfully, some physicians around the world have reported anecdotally that the severity of patients that they've cared for has been mild. But right now, that doesn't tell us much, because unless you control for the age of those patients and their underlying medical conditions, you're not really doing epidemiology. And that's why there's an old saying, the plural of anecdote is not data. We need more data right now to really understand whether Omicron lands people in the hospital at a higher rate. But there's one important thing to keep in mind. Even if it doesn't land people in the hospital at a higher rate, if it's much more contagious than Delta and causes more infections, anything that causes more infections but lands people in the hospital at the same rate will still lead to that many more people being in the hospital, just because many more people might be infected because of the contagiousness. The final area of inquiry that I wanted to touch upon is therapeutics. Will currently available drugs like monoclonal antibodies still be as effective as they are right now? What about forthcoming drugs, like, say, the oral pill from Merck that's expected in the next month? How well will that work? There too, we need to wait for the data before we jump to any conclusions. Now, I want to touch on one thing that's also on folks' mind, which is how will we know if or when it arrives? How do we look for Omicron? And that's through a process that we've talked about before, called genomic sequencing. Here in Maine, we take a percentage of the positive samples that we receive every single week, and working with our partners at the Jackson Laboratory, look at the RNA fingerprint of those positive samples, those viruses. We then compare those fingerprints to an international catalog of other fingerprints to see which viruses in Maine belong to which variant families. Now, for the past several weeks, months, 99.9% of all the samples that we've sequenced in our state have been the Delta variant. But this is how we're on the lookout for Omicron if or when it arrives in Maine. Now, in closing, I want to talk about what all of this means for you today. Well, here's a couple of things to keep in mind and a couple of things to do. The first thing to keep in mind is that I know this sounds scary, but it's unlikely that Omicron will put us back at square one and rewind the clock to March of 2020. There have been other variants with concerning mutations that did not lead to widespread transmission. The bottom line there, once again, is that we need more data. Look, the virus is going to virus. Our job is to understand what that means for you and equip you with the best available information. So what can you do? Well, you can do your part by staying informed and relying on trusted sources of information. We don't know yet what the data will tell us or when those data will be ready, but we don't need to wait and do nothing. Right now, there are at least 3 things that you can do immediately to start keeping you and your family safe. Of course, the first thing is if you haven't been vaccinated, do so. If you have been, go get a booster. And third, this is a great time to be wearing a mask indoors, particularly in public settings. The value of some of those core things, like wearing a mask, has not diminished, even in light of these newer variants like Omicron. And finally, while we're waiting for the scientific process to unfold before our eyes, let's not forget about the virus that's in front of us right now. The Delta variant, which is here today, is already causing record cases, record positivity rates, and record hospitalizations. Omicron is a spark on the horizon. The Delta is the fire that's blazing here today. So with that, I will turn things over to Commissioner Lambrou for a happier set of notes.
Thank you, Director Shaw. And to turn to some good news, Last month, the Maine Department of Health and Human Services, in partnership with the Maine Department of Education, invited Maine youth ages 5 to 17 to submit videos to help us in our education efforts on vaccination. Today, I am excited to announce the winners of the video competition for Maine children to encourage COVID-19 vaccines. The winners are, for first place, Renee Morin, Ali Saywell, Hunter Roberts, and Ian Kruger from Kennebunk. In second place, Spencer Mahowski from Columbia. And in third place, Natalie Waters from Portland. All of these videos can be seen on Maine CDC's YouTube website. Congratulations to the winners of Maine's COVID-19 Kids Vaccination Video Contest. They displayed creativity, conviction, and courage in their submissions. We are also deeply grateful to every Maine child and teenager who submitted an entry. They are truly public health champions. And with that, I think we can see our winning video.
COVID stinks. People are catching it and getting really sick. We use lots of stuff to keep us safe, like seatbelts, or sunscreen, or a life jacket. You know, in case you fall in. Same with the COVID-19 vaccine. It's just a quick shot, and it'll protect you and your friends from COVID, so you can play with your friends again. Think of your COVID-19 vaccine like your superpower.
Thank you. Director Shaw, I'll turn it back over to you for questions.
Great. Well, thank you, Commissioner, and congratulations to our winners, as well as all of the other kids who took time to submit an entry. Very much appreciated. We are going to turn to our colleagues in the media for questions. Just as a reminder, the Commissioner and I have a hard stop at 3 p.m. So I'd ask that you be respectful of your other colleagues so that we can get through all 12 of our questions. And the first question for today goes to Dan from WGME.
Thank you, Dr. Shaw. And I don't know how I can follow that commercial there, the PSA. That was great. Congratulations to those kids. But I want to go off of what you talked about with the Omicron variant and ask you a little bit more about contact tracing efforts and ask, how important do you believe contact tracing efforts will be in containing the spread of this strain? And do you believe right now that the state's current contact tracing infrastructure is enough to contain that?
Yep, Dan, I'm glad you raised that. So let's start with where we are on contact tracing. Maine is still conducting contact tracing. We have a team here at the Maine CDC who receives the list of close contacts from confirmed cases. We work with those individuals. We enter them into our symptom monitoring platform to help them themselves monitor their own symptoms in case they develop a fever. And so our contact or other symptoms of COVID, our contact tracing hasn't stopped. Here's the thing when we talk about Omicron though, contact tracing is important insofar as that it is a core strategy of any disease control, right up there with case investigation, masking, all of the other things that we've talked about. Contact tracing is one of the things that we do on our end. But I don't want to place false reliance upon contact tracing for this very technical reason. Genomic sequencing, characterizing the entire RNA fingerprint of any virus takes a few weeks. Right now in Maine, where we have some of the most sophisticated platforms because of our partners at the Jackson Laboratory, going from a sample to the full database of the RNA fingerprint can take more than a week, sometimes 2 weeks. Nationwide, we've been told by the US CDC that the average is about 14 days. The reason I mention that in connection with contact tracing is that it's important to note that after 14 days nationwide, at any state and any jurisdiction, most folks may have already recovered. Contact tracing remains important for anyone with COVID, but I don't want to give you the false impression that it is a special strategy in the face of Omicron. It's important, we are doing it, we've always been doing it, but it is part and parcel of the broader approach that we need to be taking for Omicron. That includes things like vaccination, et cetera.
Thank you, Dr. Shaw.
Thank you. Brian, over to you.
You say you need more time, more data. Ballpark, how much time do you think you need before you have a little bit more information?
Yeah, exactly 3.5 days. No, of course, no, Brian. So it's hard to. So here's a way that I can go about answering that a little bit more deeply. It's not so much exactly on what day certain data will be known. It's just as much about the order in which we expect data to come out. So if we go back to some of the key questions out there, probably the first set of data that we will start to have a glimpse on will be the contagiousness. I've already started seeing some very rough models by noted epidemiologists that have been posted to various scientific websites. What they're trying to do is take the data from places that we believe Omicron is circulating, like a particular province in South Africa, and fit those data to a model to help us understand the contagiousness. I would expect those data to be among the first that come up. I'm not sure when. Then, Brian, the second wave of data we may see is initial findings from laboratory scientists on the antibody levels that are generated after a vaccine, or how well current antibodies work against Omicron. Scientists that have briefed state health officials have indicated that that will take a few weeks. Longer off in the distance will be data around things like the effectiveness of therapeutics, monoclonal antibodies, the Merck pill. I'm not sure when those will be available, to be honest, but that's a rough sense of the order in which we may see things.
And how about just a little about the collaboration between yourselves and Jackson Lab and the asset that they are and what they are doing for you?
I mean, they are critical. We have worked hand in glove with the Jackson Laboratory since truly the beginning of the pandemic. Commissioner Lambrou and I had calls with their leadership way back in early 2020. But more recently, and relevant to today's conversation, we partnered with a researcher there. Joe Lawler has written about this, who has a specialty. He's a Mainer who's trained elsewhere, but came back to Jackson. His name's Ryan, and he has a special interest and a specialty in doing this RNA or DNA fingerprinting. So we've worked with him and his laboratory to send a subset of positive results from a geographically representative parts of the state to him to help us sequence them and thus help us get a sense of what's going on. Ryan was one of the people that gave us the early heads up that Delta was starting to increase, which then allowed us to go, for example, to healthcare facilities and say, do you have the PPE you need, that kind of thing. So that's an example of how we use that sequencing data. We're extremely grateful and thankful for the strong partnership that we have with Jax.
Thank you, and I'll check back in 3.5 days.
Thank you. Crystal, over to you.
Thank you, Dr. Shaw. I appreciate you taking this question. If the Omicron variant becomes predominant in Maine, would you be an advocate for increased testing and mandatory masking and the possibility of closing schools again?
Well, you know, Crystal, without knowing, so there's a big if there, if it becomes dominant, that we don't know yet. But then also the answers to those questions really do truly depend on what we know and what we find about the virus's overall contagiousness, as well as its ability to sidestep immune protection and or cause more people to become severely ill. We just don't know the answers to those questions. So I can't really speculate on what any of this might mean right now from a policy perspective.
Thank you.
Let me correct myself really quickly. It was Eric Russell, who is on today, and not Joe Lawler, who wrote the really great piece about the partnership with Jax and profiling the scientists there. Eric, my preliminary apologies. I hope you don't have to correct me when we get to you. Let me go to Emily from the Sun Journal next.
Hi, good afternoon. I'm wondering with Omicron, I think we're all going to struggle saying this for a while. I know we don't know much about it yet, but you've spoken before about these pockets of unvaccinated people. If you live in one of those communities, is there reason for concern, in case this does turn out to be more severe than Delta, or even with Delta, going into the holiday season?
Yeah, I mean, I'll start, Emily, but again, Commissioner and I have discussed this, so Commissioner, please weigh in. Emily, I want to start my answer to your question with where I left my screed today, which is, Omicron is concerning, and it is being studied, but Delta is what we're contending with right now, and Delta alone is what's landing people in the hospital and on ventilators. And so I don't want to give folks the impression that Delta is something that we can forget about, or that is no longer a threat in the face of a new concerning variant. Delta very much is the threat that's in front of us. Omicron may be, for some folks in communities that you noted, Emily, an extra push or nudge to go out and get vaccinated. I think that's a reasonable thing to do based on the little that we do know. There are signs that it may be more contagious. In and of itself, that's a reason to go out and get vaccinated. But the real reason to go get vaccinated is the threat from Delta that we're facing today. Omicron may be a bootstrap on top of that. As we know more, I might turn up the dial on that even further. Based on where we are right now, Delta alone should be a reason to go get vaccinated.
So quick
Or
follow-up
boosted. Or boosted.
Or boosted. So quick follow-up to that. How would someone know, if they're living in one of, a community where there's big pockets of these people, as we're going into the holiday season, it's getting colder, people are trying to assess the risks of the places they, interact with?
Sure. Emily, there are two sources of data. The first is we have a map on our website that notes vaccination rates by zip code. So you yourself can take a look and see if in your zip code or a zip code you may be traveling to, what the vaccination rates are. We do a similar thing for case rates as well. See, the two, of course, are connected, but that map is on our website, and that would be a good place for folks to start. I don't want to necessarily buy into the assumption that the risk is that much higher in one place or another. There's uniform risk across the state. Every single county in Maine has a, quote, high rate of community transmission per the US CDC. But to the extent that folks are wondering whether they are in one of those pockets of lower vaccination, we have those data on our website.
Okay, and real quick, final question. What does our testing capacity look like right now? And are there plans to expand testing?
Testing remains a challenge. The Maine CDC laboratory continues to do a high number of PCR tests every single day, upwards of 1,700 per day. There are numerous other laboratories, commercial, hospital-based, all across the state that are also working as hard as they can to churn out as many tests. We are separately working to try to secure more and more tests for different places across the state, outbreak settings, things of that nature. Testing and testing access remains a challenge nationwide as well as here in Maine, but we're working tirelessly to try to increase that.
Okay, thank you.
Thanks, Emily. Chris, over to you.
Hi, Dr. Shaw and Commissioner Lambrew. I'm assuming I'm the only Chris on the call. Hey, sorry, I just wanted to start with one that hopefully is a quick yes or no question. One that came from a viewer. Do kids 12 to 17, is there an expectation that they will need a booster at some point?
Trying to do a yes or no, but
okay, sorry.
Yes, and right now, 2 days ago, Pfizer submitted an application to the US FDA to ask for emergency use authorization for 16 and 17-year-olds to receive the Pfizer vaccine as a booster. So not 12, 13, 14, 15-year-olds yet, but 16 and 17-year-olds. I don't know when or if the FDA will approve that or authorize it, but that's the state of play right now. Right now, the recommendation for boosters is only for those 18 and over, but soon we may have 16 and 17-year-olds in the mix, but I don't know when, and that's a US FDA decision.
Got it. I did want to ask about, a topic that came up, I guess it was 2 weeks ago now, just kind of the plans regarding our hospital capacities. Are there plans in motion yet, either to bring in some reinforcements as far as like traveling nurses or setting up kind of those remote locations, those extra locations to provide extra hospital beds? I know you had mentioned the kind of the capacity of fully staffed and equipped beds, which I know is the big challenge. So how do we handle this as we expect, as we talked about 2 weeks ago, the cases and hospitalizations to rise in the coming days and weeks following the holiday gatherings?
Sure. I mean, we're no longer in the planning phase. We are in the execution phase because we have seen these record high numbers of people in Maine hospitals with COVID-19. That has taken the form of a very targeted approach based on what the needs are. We are working with some hospitals on staffing nursing facility beds to decompress those hospitals, moving patients who otherwise are occupying a bed but don't need to be in a hospital to a nursing facility to free up some room. We're working with other facilities on what are called swing beds, beds that are in hospitals but could be used as nursing facility beds for a similar purpose. We're working on bringing our public health nurses with volunteers and other types of support to different outpatient settings to try to administer those therapeutic drugs to keep people out of hospitals. So we have been working with our hospitals primarily because the hospital capacity is high, as well as with our nursing facilities to really try to load balance out our patients in Maine. We still, as of today, report 45 staffed critical care beds in Maine. We have been using those beds, really using our rural hospitals as sites for people with COVID-19 now that we've learned more about how to care for it. But we are, certainly working with our healthcare system now and plan to intensify that in the coming days and weeks.
Okay, thank you. And my last quick question, there's been some discussion from viewers. We've had emails, basically people saying, we've heard the message that the booster at this point, it's encouraged and Dr. Shaw, I don't know if this is an overstep, but to say that it's essential at this point. But I have, also heard from people saying that it's been tough to find. It might take them driving, maybe 20 or 30 minutes away from their hometown to actually get the shot. Have you been hearing that, and what's the plan to address that?
Yeah, I have been hearing that, Chris. First, I think where I'm at right now on the recommendation is largely where the US CDC director, Dr. Walensky, is, which is everyone 18 and over should get a booster. And I think that's what the science suggests. But in terms of access, yep, Chris, you're right. I've heard that as well. I've gotten emails, I've seen on social media, people booking appointments that get canceled at the last minute. I followed up with the regional folks at that particular chain at Walgreens to inquire about why those cancellations were happening. Was it a matter of vaccine supply, which we can help with, or was it what we feared, which was staffing? The answer that I got back was staffing. We're working with them to examine more what can be done. Right now, the other thing we're doing is some of the sites that are dedicated to vaccines. For example, the site in Sanford, operated by York County EMA, the site in Auburn at the Auburn Mall, operated principally by Central Maine. Those sites have been open and active throughout the year. We're working to shore up their capacity. They've been doing 500, 600, 700 shots per day. It's a site that people know. It's a site that's remained open. We're working to see if we can find additional volunteers and staff to shore those up even further. And then finally, working with other providers to offer more, perhaps one-off days, large-scale clinics, because we know there's the demand out there. Chris, last week, we worked with an independent pharmacy to do a pop-up clinic at a McDonald's in Waterville and did over 200 shots in 2 hours. So we know the demand is out there. We've heard those concerns and we're working to address them.
Thank you very much.
Thanks. Let me go to Brian over at WAGM.
Good afternoon, Dr. Shaw. I have two quick questions for you, and one of them you touched on briefly, but with reports of Omicron being detected as close as Quebec, and with the opening of the U.S.-Canadian land border and the lifting of PCR testing requirements for Canadian citizens, how concerned is the CDC, and how concerned should residents of border towns be with the spread of this new variant?
Well, Brian, it's less about concern as much as it is about making sure we have the facts, making sure we convey the facts, and then making sure that folks who are out there who themselves are concerned, as you noted, are doing what they can to stay safe and be protected. Border towns, in this respect, have a bit more exposure because of where they are relative to the Canadian border, but that presupposes that this is going to come from Canada. It could just as easily come elsewhere in the United States rather than from our partners or friends to the north. So we don't know where and through what route Omicron will eventually land in Maine. The one thing we can do today is to take steps to be ready for that. And that includes vaccinating, making sure you're wearing a mask, getting a booster.
Excellent. Thank you, Doctor. And my last question, is the CDC currently tracking any active outbreaks in Aroostook County?
I suspect we are. We can get you a list, Brian. Just in an effort to keep rolling through questions, I won't try to tabulate it on the fly, but we can certainly get you a list if there are any right now.
Thank you very much, Doctor.
Yep. Patrick, over to you.
Thank you very much. So these statistics that you provided us with earlier, the number of folks in critical care units, the number of folks on a ventilator, number of hospitalizations, these numbers are fairly alarming. And I'm wondering if you can give us sort of a bird's eye view kind of look at why this is happening here now, because the state continues to have one of the highest vaccination rates in the country, but this sort of seems to be arriving in spite of that.
Yeah, no, that's the right question to ask, Patrick. Our team has discussed that, and there are two things that are driving, in particular, the hospitalization rates. Number one, at baseline, it's just vaccination levels. And what we've seen in what has been relatively stable for several weeks, if not months now, is the percentage of individuals who are in hospitals who are not fully vaccinated, which has been pretty consistently right around 60%. But to answer your question, Patrick, about what's driving the increase in ICU admissions, almost at 100, number of ventilators, record high today, sadly. What we see when we take a look at those patients, the very critically ill patients, when you take a look at their vaccination levels, it's not 60% who are unvaccinated, but rather up to 90%. Indeed, at some points over the past few weeks, the two largest ICUs in Maine, in Portland and Bangor, at certain points over the last few weeks, reported that 100% of all of the patients who were either in the ICU or on a ventilator were unvaccinated. That's not at all times, but from time to time, it's been 100%, every single person not being vaccinated. That's part of the explanation. The other, though, Patrick, is it's not just so much the aggregate levels of vaccination that matter. It's also, to Emily's earlier point, the fact that in many places in Maine and in other parts of the country, we see pockets, aggregate folks who are not vaccinated. This just allows the virus to run free. It's like a fire on the prairie. When it arrives in places where there has been no one who's been vaccinated or anyone who has had prior existing illness, in that setting, the virus just runs free. And I think that is a large part of what we are seeing in terms of the hospitalizations right now.
So it sort of has to do with the sort of the in-county variation we see, particularly in rural areas.
That's true. The bulk of hospitalizations over the past 2 weeks comprise individuals from predominantly rural counties in Maine as opposed to urban areas. So it's not just the aggregate percentage of folks who are vaccinated, it's where they are in relation to others. And if they're clumped together, that's just fire and kindling as far as the virus is concerned.
So to increase vaccination levels in rural parts of the state, the state has tried outreach efforts, the mobile unit, milkshakes, so many things. What are the tools that are left in the toolbox?
I'll start, but Commissioner, please weigh in if you from your perspective as well. But Patrick, I think it's partly continuing to use the tools because they are working. I mean, they're again, we had a lot of folks last week in Waterville. We're continuing to see clinics that are continuing at hospitals in rural parts of the state be well subscribed. So part of it is just continuing to use those tools. I mean, we plowed the road, it kept snowing, we're going to keep plowing. But then also we're looking for ways that we can connect with folks. Maybe having folks in rural counties hear from others, friends, family members, compatriots who themselves got vaccinated and found it to be a good thing to do for themselves or their family. We're looking at ways that we can tap into that as well.
Okay, terrific. Thank you very much. I just wanted to reconfirm one of the numbers. You said that of the folks who are hospitalized at the moment, about 60% of those are folks who are not vaccinated, or no?
That is correct, and that is an average number that has not really moved appreciably up or down in several weeks, actually several months now. So it's an average aggregate number, not a point estimate.
The percentage is higher among folks who are seriously ill.
Yep. So actually, that is correct as well, Patrick. And just to give you the point estimate, the last time we collected that data was last week on November 25th, exactly 66%. So as of November 25th, just to give you the precision, 66% or 2/3 of everyone in a Maine hospital was not fully vaccinated.
Got it. Thank you very much.
Yep. Let me go over to Patty White next.
Thanks, Dr. Shaw. Commissioner Lambrou. The WHO is recommending that there be enhanced sequencing to detect variants. Is Maine, I know we've been ahead of the game on that compared to other states, but are we expanding our efforts?
It's not so much about expanding them, Patty. So yes, that is true. That the US CDC is actually in keeping with that, activating what it is calling its enhanced viral surveillance network, which is a system that they have that works with states to understand and better characterize all of these variants that are at play. Again, because of our partnership with Jackson, it's not as if we have to resurrect our sequencing. It's always been happening, but now we just want to make sure that the samples that we send to our colleagues at Jax are ready to go, that they're geographically representative from the northern parts of the state, southern parts of the state, west, east, et cetera. We've been doing that all along. Now we're going to make sure that it's all systems go and ready to keep moving.
So not necessarily any more samples.
I don't want to say so yet, Patty. I mean, the percentage of sampling that Maine had been doing, as you noted, was already among the higher in the country, well above the national average. The goal of sampling is not necessarily to characterize every single positive one, but as the name implies, to take a sample so we have a bird's eye view of what's unfolding. The levels that we have been at have been sufficiently high to meet the statistical test to ensure we've got that bird's eye view. So I don't know that we need to increase that, but I'll have to double check with the team.
Oh, sure. And when did Maine start sequencing for Omicron?
Oh, okay. So good question, Patty. We don't sequence. We sequence, period. Sequencing allows you to determine whether the genome, the RNA fingerprint, whether it belongs to any family out there. So when we undertake this, we don't set forth and say, let's see if this is Omicron. The question is different. The question is, let's see what family of variants this sample belongs to. Alpha, beta, gamma, delta. There are others out there as well, now Omicron. So it's not as if the inquiry is this Omicron, yes or no? The inquiry is, into what viral variant family does this sample belong? And to answer your question, we started sequencing, I'm not sure. I'll have to go back and check with the team, months and months and months ago. January maybe, but there is a date and I will find it for you.
But I guess even though you're sequencing for many variants, I mean, Omicron is kind of new. So is that something you would even detect I mean,
Yes.
this is, yeah,
Yes.
okay.
So sequencing is not, it's not a test, right? And that's, I want to make sure I answer your question completely and fully here. Sequencing is not a diagnostic test. It's not as if we have to create a new platform to help us see whether we have Omicron and buy a bunch of new chemicals and new samples. Sequencing is not a diagnostic test. Sequencing is a laboratory exploration that just helps, that characterizes the exact RNA fingerprint of the virus. We don't need to do anything specific in order to determine whether the sample that we're testing is Delta or Omicron. We just need the results, which we then look into the catalog to see where it matches up.
Got it. All right. Thanks so much.
Yep. Megan, over to you.
Thanks for taking my question. Yesterday, actually, excuse me, Monday, over 500 cases were reported in Maine schools. I'm not sure if that's a single day high, but I'm guessing that's probably the case. So I don't know the percentage of those cases that come from schools that participate in pooled testing, but would you overall say that the pooled testing strategy is effective? And is it effective if not everybody in the school is enrolled in it, if the school has chosen to participate?
Sure, I'll start, but Commissioner, please weigh in here as well. Megan, the answer to your questions is yes as to both. So has it been effective? Yes, unquestionably so. The school year thus far is that pooled has found those positives have later been verified through follow-up rapid testing, and those students could be back at home rather than in the school setting, and therefore limiting transmission. I shudder to think what the school year would have looked like were it not for the early warning system that pooled testing provides. Your second question is it still effective if not everyone is participating in it? Yes. Now, in an ideal world, would I like for every student to be participating in it? Yes, I would. That would increase its utility. But as with so many things, it's still effective, even if it's not at 100%. We're continuing to work with schools to try to get more and more students online, not too late. But even at sub 100% levels, it is still an effective tool.
If I could just epidemiologically ask, this quote unquote rise in cases or this surge in cases in schools, is this, I know we've talked about how the virus is opportunistic and a lot of the younger kids have yet to have a full vaccine series or be considered fully vaccinated. Is it the function of the virus being opportunistic, looking for places to infect, that we're seeing this in younger kids now?
Yes, I'm glad you raised that point, Megan. It connects very well with what Patrick noted a moment ago. Let me first start by just on the commenting on the case rates. I would just have to check from what reporting period that Monday figure encompasses. Given the holidays and such, it's just an important data element to keep in mind. But in keeping with what Patrick had noted about what's going on in Maine, a lot of the case growth that we've seen in the past 2 or 3 weeks in general has been among unvaccinated folks. I've already mentioned that, but in particular, it's also been, it's of the unvaccinated, a lot of it has been through younger groups that just recently became eligible, 5 through 11-year-olds or even 12 to 17-year-olds. That's where we've seen a lot of case growth just in recent weeks. That's been matched nationally as well. It's not a Maine specific finding, but yes, that underscores the importance for why everyone 5 and over should go out and get vaccinated.
And I will just add on pooled testing that, we do continue to encourage, schools to participate and parents to sign those consents, but Maine is actually doing relatively well. 1 in 4 students and staff in Maine schools is participating in school testing. So we want that to be higher, but that's not bad. We have a long way to go. And another benefit, in addition to identifying those cases and quickly getting them into isolation, is that the other children in that classroom participating in pooled testing don't have to quarantine necessarily. They can participate in school activities. They can go to class if they're part of a pool testing program, and the school is following those protocols. There's a big plus to it, both for those, good reasons of getting a sick kid home and safe, as well as keeping the other kids who are close contacts in schools.
Yeah, I mean, I'll pick up on that. Just one. I mean, there's a lot of chatter out there about test to stay. Pooled testing is Maine's vehicle to effectuate test to stay. That is how we accomplish test to stay in Maine, as the commissioner noted.
Thank you.
Yep, thanks, Megan. Eric Russell, over to you, and with apologies for confusing you with Joe.
No need to apologize. Thanks for taking the time. So this question has been asked a bunch, and I hate to ask it again, but we've had some tools in place for a while, and sometimes they were in the form of a mandate like masks indoors and gathering restrictions and other things that we used in the early part of the pandemic. And I know both you and Commissioner Lambrou have said that those tools are likely not coming back, but given how much worse things are now than at any other point during the pandemic in terms of hospitalizations, in terms of deaths, in terms of cases, and everybody's saying it's going to get worse into the holidays, why not? Why not do anything else?
Sure. And I do want to just remind people what is in place. Earlier somebody was talking about travel. There are still fairly strict travel guidance that the US CDC requires. They're not recommendations, they're requirements to try to limit spread in that way. Director Shaw mentioned the community transmission map. Maine is in moderate and high community transmission in all counties, which means we strongly recommend, following US CDC, that people wear masks in indoor public settings. We similarly encourage all schools to adopt universal masking as a means of protecting people against COVID-19. But it remains that a COVID-19 vaccine is the best way to prevent somebody from becoming seriously ill or dying from this disease. So we continue our tireless efforts to try to figure out how we can encourage and get people vaccinated. And I do think that the progress we've seen in the last month, both with the kids 5 to 11 rolling up their sleeves and getting vaccinated, as well as people going to get their boosters, which is also sometimes a family affair, bringing along somebody who might not have had their first dose yet. We still continue to see progress, and we will not rest until we get those numbers high, because no amount of other protections and precautions, which do have effects on the economy, on mental health, on attendance in school, on other sorts of activities that are also critical to health, none of that is going to be as effective as getting people vaccinated.
I guess the second question I have is around testing. Certainly, we've heard anecdotally, and I'm sure others have too, about delays in getting access to a test and delays in getting results to a test. And I know you touched upon it a little bit earlier, but it seems like at this point in the pandemic, it's counterintuitive to have to wait 2-3 days to have to get a test somewhere, and then maybe to have to wait another 3 days to get the results of that test. And I wonder if you can talk a little bit about maybe why this is happening, if it's a supply issue, and sort of how that's having some ripple effects, if at all possible.
I can start.
Okay.
The commissioner, I've been very focused on this recently as well. And Eric, not to give you a partially unsatisfying answer, but in terms of turnaround time, the only thing that I can really comment on, and that which we have control over, is the turnaround time at our laboratory here in Augusta, which remains at 24 hours or under 24 hours. That's our benchmark, our goal, and we've been able to maintain that, even though we've been getting quite a high number of samples. But I have heard that in other laboratories, national laboratories, as well as others in Maine, turnaround times have been on the 2+ day mark. I think, and from what our conversations with lab directors has been, that's just partly a function of the extremely high demand for testing. Now, in terms of access, you're right, and we concur that access has been a challenge. We've done a couple of things lately that the commissioner and I can outline. One of which has been to look for areas where there have been, I'll call them testing deserts. So we've recently set up testing locations that are operated in partnership with either local groups or with volunteers that we've tapped, for example, in Calais. We're also expanding testing options in, say, Westbrook, working with the old swab and send that we had there to increase the volume that they've got. Testing is a challenge, no question about it. You asked the question of why, and a lot of it is just extremely high demand coupled with, unfortunately, challenges around staffing.
Thank you both.
But Commissioner, that's my quick 2 cents. Anything? Okay, very good. Thanks, Eric. Annie, over to you from Spectrum.
Hi, thanks for taking my question. This is also sort of pursuant to the school spike that we saw from the holiday break. What does the state expect will be the broader impacts of that kind of Thanksgiving travel that, seems to be linked to that spike, and also travel in later December? When might we start to see those impacts, and what would they be?
Sure. So generally speaking, we believe, as does everyone in the entire nation believes, that there will be an increase in case rates following various holidays that are focused on getting together. We want people to get together, but unfortunately, at some of those gatherings this year, there may have been transmission that occurred. We might expect to see cases. Generally, Annie, we look for case spikes after events around 10, maybe 12 days after the event itself. In some cases, even 14. So we're still a bit too soon after, say, last week's holidays to have detected a palpable increase that we suspect that we may in the coming days. The question, of course, is what the severity level of that increase may be. Will it simply be, which we hope, is asymptomatic cases, or will it translate to even higher hospitalization levels, placing further strain on the healthcare system? That's the question that we're grappling with and preparing for.
Thank you.
Mm-hmm. And finally, David from the BDN.
Thanks, Dr. Shah. Has the state's plan to rely primarily on pharmacies to deliver boosters worked in practice? As was mentioned earlier, I've heard many reports of people having trouble getting boosters or having to wait a long time to receive them. Is the concerted effort by state and healthcare providers to deliver booster shots on par with the initial spring vaccine rollout?
Yes. So, David, I would disagree with your characterization of using pharmacies as our primary means to deliver boosters. They are a channel that we have used, but by no means the only channel. Indeed, as I mentioned, some of the large sites that have still been in operation, York County, Auburn, they have seen record numbers of individuals come through their doors just in the recent couple of days looking for boosters and first doses. So pharmacies are important, but they are not the only game. The other thing that we've done much more of now as compared to the primary series is work with primary care doctors. Indeed, someone who I know just got their booster at their primary care doctor's office just in the last 24 hours. That's different from the rollout earlier, where because of the impetus to get as many people vaccinated so quickly, primary care offices were not the first place we went to. But now, with the addition of childhood vaccines, we've really built out much more infrastructure there. But Commissioner, let me turn it over to you for any other comments. No.
We just continue to work on it. When we hear about problems, we identify them quickly. We try to figure out what are our options, and hopefully we will have news on how we can improve access to booster shots in the coming weeks.
Mm-hmm. So, David, in light of that, we recognize that there have been anecdotal reports of folks facing challenges. At the same time, our numbers are quite, we're still boosting a lot of folks, but where we hear about those challenges, whether they be staffing related or hopefully not supply related, because we have a robust amount of vaccine in the state, we try to jump on that and see what we can do. We're going to keep looking for venues, as with the event in Waterville, which generated more folks than we were, than we projected, which is great. We're going to keep looking for opportunities like that to meet people where they are.
Great. I appreciate you answering that. I'm going to ask my second question really quick. I did an analysis of long-term care outbreaks. Since the availability of the vaccine, deaths as a percentage of cases have decreased by half. Basically, they've gone down quite a bit. What does that show to you? And could that change with Omicron and with the Delta variant surge right now?
Sure, I can start, Commissioner, if you want. So, David, as it relates to Omicron, too early to tell. Really too early to tell on that severity access. But you make the right point. Further proof that vaccines, boosters in particular, as well as having healthcare workers, staff be vaccinated, those two things in concert with one another, pretty clear before and after picture. Pre-vaccines, pre-boosters, pre-healthcare worker vaccinations. It just shows the power when everyone is vaccinated in a particular area, how much that can affect things like deaths. Each of those deaths is sad and unfortunate. Vaccines are our way to prevent them. That is our extent of questions for the afternoon. Commissioner, I'm happy to turn it over to you for any concluding remarks.
Sure. I would just remind people that the COVID-19 vaccine is free. The testing that the state organizes through, for example, drive-throughs at Walgreens is also free. But when people are hospitalized for COVID-19, that can often be very expensive. That's why people who are uninsured, who are looking for more affordable coverage options, should go to coverme.gov. It's open enrollment through December 15th. You can sign up for a plan for January 1, and the last date sign up for a plan for 2022 is January 15th. You can also call 1-866-636-0355. Healthcare coverage couldn't be more important than ever. So thank you.
Thank you, Commissioner. Thanks to all of our colleagues in the media, and thanks to all of you for taking some time out of your afternoon to tune in. We hope everyone has a good week. As always, please be kind and take care of one another. We'll see everyone again soon.